Hello and welcome, lemurs and leprechauns, to a very special simulation episode of EMSNation. Today we're joined by none other than Dr. Joseph A. Bart, EMS Division Operations Manager, Assistant Professor in Emergency Medicine, as well as the Associate EMS Fellowship Director at the Erie County Medical Center. Dr. Bart is an instructor at the National Center for Security and Preparedness, delivering operational training programs through the New York State Preparedness Training Center. In addition, Dr. Bart serves as the Director of the Special Operations Sector for the Specialized Medical Assistance Response Team, or SMART, in Erie County, New York. Selective spinal motion restriction is a hot topic in EMS, and whether your state is one of the leaders in heeding the evidence and eliminating the routine use of the longboard for immobilization, or still on the road to incorporating the best evidence-based practice, this sim will serve as a useful tool on how to appropriately use the longboard as an extrication device. As always, remember to follow your appropriate regional as well as state protocols. As an added bonus, I'd like to introduce the concept of Triage Tuesday to EMSNation. While MCIs may not be routine in your service, flexing your triage algorithm at an actual MCI may not be the best place to practice the appropriate designations or tags for your patients. Many in the EMS community employ Triage Tuesday and practice tagging their routine patients so that if and when an MCI does occur, they are well rehearsed and can employ the algorithm fluidly. Stay tuned till the end, where we'll review the scenarios and the appropriate tag using the START triage algorithm. Enjoy this simulation podcast featuring Dr. Joe Bart and the NCSP.
This presentation will be a demonstration and learning tool about suspected spinal injury. The State Emergency Medical Advisory Committee, together with the Bureau of EMS, has released a new spinal injury protocol. This protocol will focus heavily on the evaluation of the cervical spine and when to use a cervical collar. The backboard will no longer be mandatory for use on all trauma patients. Additionally, the standing takedown will no longer be used. Much of the reason why we use the backboard to immobilize is the real perception that we needed to immobilize the spine. As we will demonstrate, spinal motion restriction can be accomplished without the use of the long spine board. Next, we're going to head out to the State Preparedness Training Center in Oriskany, New York.
Medic 2 on location.
Copy that. Time on scene 0937.
Woman in the dark sweater here, her arm is complaining about, and also a cut on her eye. Is she all right? It's okay here in this vehicle.
Hi, ma'am. Were you in this vehicle here?
Yes, I was.
Okay. I'm going to have you hold your head straight for me, okay?
Okay.
Carlos is going to come behind you. He's just going to make sure that your neck doesn't turn, okay?
My name is Barbara.
All right. Are you by yourself in that vehicle?
Yes.
All right. And is anything hurting you?
Just my wrist.
Just your wrist? Which one?
My left one.
Your left one? Okay. I'm going to touch the back of your neck. I want to make sure there's nothing wrong with your neck or your back, okay?
Okay.
When I touch the back of your neck, in this spot, can you feel that?
I can feel it, but it doesn't hurt.
There's no pain there?
No.
I'm going to go all the way down your back.
Okay.
Any pain there?
No.
Okay. Nothing there?
No.
Very good. Okay.
I did have my seatbelt on.
Good. I'm going to check your arms now, okay? I know that you're having some pain in that left wrist, so can you squeeze my fingers real
Yes.
tight? And do you have any numbness or tingling in your hands or your feet?
No.
No? Okay. You can stop holding stabilization here. Do you think you're going to want to go to the hospital and get this checked out? Or?
Yes.
Okay. We'll get you splinted up, but if we give you a hand, can you walk to the ambulance with us?
Sure.
Very good.
Hi, Barbara, I'm going to help you walk over to the ambulance. So we come over there, just be careful.
In this scenario, we want to show the use of the long spine board as a tool. Some of you may be asking yourself at this point, if I'm not supposed to be placing patients on the long backboard for purpose of immobilization, then what could I use it for? I would use the example that the prone unconscious motorcycle patient lying in a ditch is probably best extricated from that ditch using a rigid device. And I think the long spine board would probably accomplish that for us. In this particular scenario, you'll notice that the responding EMTs are going to assess a conscious and alert patient complaining of spine pain, particularly in the cervical spine, in which scenario 1, that person will be appropriately dealt with a rigid cervical collar, and then facilitated via assistance from the vehicle. In the second scenario, where that patient is not as ambulatory or complaining of some lower extremity pain, the facilitation of extrication using the backboard as a tool could help you.
How you doing, man? I'm going to have you keep your head straight, okay?
Oh, jeez. Alright.
Anything hurting you?
My neck. I don't know what happened.
Ma'am, what's your name? Don't move your head.
Rose?
All right, I'm going to take your seatbelt off for you.
Okay.
I'm going to hold your head straight with my hands, okay?
Okay.
Nothing hurts there where I'm touching you?
No.
Good. You feel any pain anywhere?
Yeah, my neck.
In your neck? Okay.
Yeah.
All right, Rose, my name is Carl, so I'm just going to, you might feel some pain.
Yeah,
I'm coming down. You feel pain right there?
Yeah.
Okay. All right, I'm going to work it. I'm going to work my fingers down. You let me know if that hurts any more or any less.
Yeah, that hurts more.
Okay.
Okay.
All right. And what about there?
No.
Okay.
There's a collar right on the...
Okay. I'm going to check your back here real quick.
Okay.
All right. You feel any pain down here in your lower back?
No.
As I'm coming down?
No.
All right. Rose, I'm going to put a piece of plastic. It's a collar right around your neck.
Okay.
It's going to keep. It's going to.
Okay.
Okay. You feel like you can stand up?
Yeah.
Okay, we're going to help you out.
Okay.
Okay. Just swing your legs over.
Keep your neck as straight as possible.
Yep, absolutely. Good. Good.
Okay.
Just sit right there just for now.
Okay.
I'm going to set the stretcher up for you. I'm going to bring it down and have you sit right on the stretcher. All right, Rose?
All right.
All right, Rose, can you tell me what day it is?
Thursday.
All right, awesome.
Yeah.
Right behind you, Carlos.
Rose, you taking any medications for anything? I'm going to help you up now.
Okay.
Are you allergic to any medications?
No.
Do you have any medical history at all?
No.
All right, you don't have any history of seizures or anything like that?
No, nothing.
All right.
Backing up,
Just sit down.
Sit
All right,
down.
good. Good. We're going to put your head to this side here. I'm going to help you with your legs coming up.
Okay.
You ready?
Yeah.
1, 2, 3. Good.
Lay all
Just
the way
center
back.
yourself.
Okay.
Can you center yourself just a little bit?
Yeah.
All right, good.
All right. Yeah, that's better.
All right, Rose, we're going to
Yeah.
put some straps on you.
Okay.
All right, so it's going to keep you on the stretcher itself, okay?
Okay.
I'm going to have you keep your head straight, okay?
Okay.
I'm going to put this right here.
Get in the car right behind you.
Anything hurting you?
My neck. I don't know what happened.
Listen, I'm going to take your seatbelt off of you right now.
Okay.
Okay, it's the only way I can get this door open, okay?
Okay.
Just move your arm for me. Good. Thank you. All right, Rose, you feeling any pain right now? Any place?
Yeah, my neck.
Your neck? Okay,
And my
just your
knee.
neck?
My knee.
And your knee. Okay.
Yeah.
Any place else?
No, I think that's it.
All right. What I want you to do, Rose, is I want you to take your hands off the steering wheel. Wiggle your fingers for me. All right, good. Pulse is present. Close your eyes. What finger am I touching?
Thumb.
What finger am I touching?
My thumb.
Okay. Wiggle your toes for me. All right, which toe am I touching?
My big toe.
Okay, which toe am I touching?
My big toe.
All right. Check for pulses. Pulses are present. All right. All right, Rose, I'm going to come right behind you on your neck. I want you to tell me when it starts hurting, okay?
Yeah, that does
That hurts
hurt.
right there?
Yeah.
Okay. How about here?
Yeah.
Okay. Is it getting better or worse as I go down?
Worse.
Okay. All right.
Yeah.
All right, I see that. Okay.
All right.
What about here?
Yeah, that hurts.
Okay. What about here? I'm coming off of your neck onto your back now.
No.
Okay, you have no pain there?
No.
Good, good. That's
Okay.
excellent. Okay. Just want to lean it forward just a little bit. Rose, you just got to get to your back.
Okay.
All right. All Are you feeling any pain here?
No.
Okay. What about here?
No.
Okay, good. All right, we're done with that. And let's take a look at your knee. That hurts right there when I touch it only?
Yeah.
Can you move your leg at all?
Not really. No.
You're not going to be able to step out of the vehicle?
No, it really
all right.
hurts.
What about this knee?
That one's okay.
All right. And you had your seatbelt on, am I correct?
Yeah.
Obviously, because I just took it off.
Yeah.
All right, good.
There's the collar on the back.
All right. All right, Rose, we're going to put a collar on you. Okay. I know this is uncomfortable.
Yeah.
All right, but it's going to help you out a little bit, all right?
Okay.
All right. All right, it's midline.
I'm going to let go. I just want you to keep your head straight, though, even with that collar, all right?
Okay.
Slide her out.
Mm-hmm.
Head or feet first?
Oh, we're going to go head first. Let's bring it down one more notch, yeah. Thanks.
I'll go around.
Okay.
Hey, Rose.
Yes, she is, ma'am.
Since this patient has knee pain, she is not able to get out of the vehicle by herself. We can use the long spine board as a tool to help extricate her from the vehicle. By placing it under her, and with controlled movements, assist her to turn and lay down on the backboard. Instead of placing her on the backboard with the blocks, straps, and tape, use the spine board to slide her onto the padded stretcher. Then remove the spine board.
Ready? Does it feel better with that knee bent?
Yeah.
Okay, good.
I'll come around if you got her.
Is that what's hurting you right now? Is your knee right now?
Yeah.
Okay. All right, we're going to get you out of here. We're going to go ahead and put something on your knee to keep it from moving, okay?
Okay.
Ready on my count?
Yeah.
1, 2, 3. All right, we're going to go all the way up on my count. Ready? 1, 2, 3. Okay. That's the worst of it. We're done.
Okay.
Like
all
that?
right?
Yeah.
We're going to bring you up.
Okay.
Knee up a little bit. Just like that, okay?
Okay, yeah, that's better.
Pad underneath that knee then.
Yep. Ma'am, what happened?
He's in a lot of pain. I don't know. I was upstairs. All of a sudden I saw him falling.
Carlos, you want to grab his head for me?
I think he was almost to the whole top.
Almost to the top?
Yeah.
I just lost my balance, I guess. I don't know what happened so fast.
He's in a lot of pain.
Okay. Carlos here is going to grab your head, okay?
All right.
My name's Kyle. We're paramedics.
Okay.
You were on the very, very top, huh?
Yeah.
Okay. Are you having any pain anywhere?
Yeah.
Where are you having pain?
My hip is really, really hurt.
Which hip?
On the left side.
The left side?
Yeah.
Okay. I'm just going to check you out over here. Any pain around here?
No.
No? I'm not going to touch that hip.
Okay.
How about your right hip?
No, it's all right.
This leg?
Okay there.
How about down here?
All right, it's all right.
Okay, just the hip?
Yeah.
Hurts? Okay.
Right there.
All right. Did you lose consciousness?
I don't think so.
You don't think so? You think you remember everything?
Yeah, my name's Frank.
Frank?
Yeah.
Can we roll? Sir, I'm going to try and straighten this hip out a little bit, okay? It's going to hurt. Okay, that's it. That's it.
That's the end of it. That's the worst.
I'm going to roll him.
Do you want me to do anything?
Okay.
What do you want me to do?
No, we're all set, ma'am. I'm just going to actually take your spot here. We're going to roll you onto your good hip, okay? And I'm going to check out your back. I want to make sure there's no pain there, all right?
Yes, sir.
On Carlos.
My count, all right? You ready?
Just grab this arm here.
Okay, ready?
Yep.
1, 2, 3. All right, I'm looking.
Okay.
I don't see anything.
I don't see anything either. Can you feel me touching you right here on the back of the neck?
Yes, I can.
Is there pain there?
No.
Okay, I'm going to go all the way down your
Go
back.
ahead, sir.
Okay.
Just answer yes or no.
All right.
Any pain here?
No.
Any pain here?
No.
All the way down, no pain?
No. It's all right.
Okay, sir.
2, 3.
Okay.
All right.
You hold his head, I'll grab the... Did you grab the jump bag?
Yep. Actually, I'll hold it. That's what I got.
You got...
Since this patient fell off a tall ladder and likely has a distracting hip injury, a cervical collar was placed on him. Several devices, such as this collapsing canvas stretcher, can replace the traditional use of the long spine board.
And did you just lose your balance up there, or did you pass out?
I don't know. I think I just lost my balance.
Okay. This is going to come. It's going to be uncomfortable.
All right.
Okay.
Okay.
Right, 3.
Okay. That's good. That's perfect.
1, 2, 3.
Okay.
That's the worst of it, right, brother?
Okay. Want to come my way, and then up to you?
1, 2, 3. Frank, you okay?
Yeah.
Bring him up.
Ready?
Yep.
1, 2, 3.
Okay. You can let go of the head there.
Ready?
In this scenario, we demonstrated a patient who was the victim of a fall. Because the fall was greater than the victim's height, a cervical collar was placed per the new protocol. In this particular situation, he was complaining of left-sided hip pain with a deformity. We were not going to be able to walk this patient to the ambulance, so they elected to use a top deck. For our next and last scenario, we're going to transition to the emergency department, where we're going to have an interaction about patient transfer directly in the emergency department with their staff at Erie County Medical Center at Buffalo, New York.
How's your pain? Okay. How's the breathing?
Crystal.
Still can't get a full breath.
Okay. They're here to take you to the trauma center now, okay? We have a 30-year-old male. He was a fall off of a ladder. He has a left hemopneumothorax with a chest tube. His x-ray was negative as far as C-spine, but he still has some C-spine tenderness, so we kept the collar on.
Right, sure.
Do you have the backboard and tape with you?
We don't. Can I ask what it would be for?
They just wanted him immobilized for transfer to the trauma center.
Yeah. New York State actually just changed the protocol on spinal immobilization, and it virtually eliminates the use of backboards in inter-facility transports, so we didn't even bring it in.
Okay, that's just what our doctor recommended. So.
Right. I mean, given that a spine board is an extrication tool and he's already in the hospital and on a bed, I think it would be better and more comfortable if we just move him over, keeping the spine in line.
Okay, if you just want to talk to him, that was just his recommendation
no problem.
for me.
What's going on?
We were just talking about the new New York State protocol for spinal immobilization.
Our state EMS committees actually developed new protocols on transferring patients. We all know it's definitely uncomfortable. We know that it's actually harmful for the patient. So if we could just utilize a slide board and maintain spinal motion restriction and get them over to the university hospital.
That makes sense. We don't keep people on a backboard in the emergency department, so we don't put them back on a backboard just to put them in an ambulance.
Sure. All right.
Okay, I'll get the slide board to get him ready.
Great. I'll grab the head, drop down the stretcher net.
Have the patient's bed approximately 1 inch higher than the ambulance stretcher. This will allow for easier and more controlled movements.
Stretcher, okay. So he's going to take your neck, we'll roll you up on your side. You stay nice and still and we'll do all the work, okay?
You got the head, Doc?
Ready to roll?
Want to put your arms right across your belly there?
And 1, 2, 3.
You do not need to completely roll the patient, just enough to get the edge of the slide board underneath him.
Everyone ready? 1, 2, 3.
Okay.
We should be able to pull that out.
Yep.
Great. Are you comfortable like that, sir?
Yes.
Okay.
Many of these demonstrations were based on everyday scenarios. A few common questions are, will we remove the backboard entirely? No. We will still continue to teach the skill, and under certain circumstances, it still may be appropriate. Another possible question is, are there certain patients that should always be transported on a backboard? Again, the answer is no. It is not based on how sick your patient is. Remember, the backboard is an extrication tool. And lastly, if a patient were to be placed on a backboard, can we remove them? By using this protocol, you may remove that patient if you determine that spinal motion restriction was not needed. We hope you have found this presentation to be helpful in understanding the new protocol. Have a great day and be safe.
EMSNation, I hope you enjoyed the scenarios put together by Dr. Joe Bart and his team. It certainly helps illustrate not only how to use the longboard as an extrication device, but also the alternative devices we have available to us. He also illustrates how demobilizing the longboard after transfer of the patient to the EMS cot can be done routinely without overburdening the patient. So, If you were following along for our Triage Tuesday activity, we'll review the cases and determine the appropriate tag for our patients using the START triage algorithm. To begin, in scenario 1, we were presented with an MVC and an ambulatory patient that had arm pain. The patient was ambulatory with an intact primary survey and a secondary survey notable for an arm injury. We can see her respirations are normal and the medic checks for radial pulses which are present. The patient is also answering questions appropriately, thus would be a green tag patient under START triage. Now in scenario 2, there are 2 parts. First, we start with Rose, who is a restrained driver in an MVC with subjective complaints of moderate neck pain. She's ambulatory with a primary survey notable for moderate neck tenderness, which many include as part of the airway assessment. She's answering questions appropriately with intact vital signs and ultimately self-extricates. In part 1 of scenario 2, Rose would be deemed a green tag. Now, proceeding to part 2 of the same scenario, she again has moderate neck tenderness to palpation. Her secondary survey is notable for knee tenderness and swelling. She has intact pulses, a normal respiratory rate, and answers questions appropriately. Nevertheless, since she cannot self-extricate from the vehicle, she will be classified as a yellow tag patient. Now in scenario 3, we are presented with a gentleman who had a fall from a ladder complaining of left hip pain, and on exam indeed does have left hip tenderness. He has normal vital signs and answers questions, though is unable to ambulate. He would also be a yellow tag under the START triage algorithm. Now in scenario 4, we have a patient who had a fall, a head injury, and then ultimately suffered a left-sided hemopneumothorax. While this scenario is staged as an interfacility transport after the patient has been stabilized, we can certainly use our imagination and presume this patient may have had a respiratory rate greater than 30 or delayed capillary refill. His cognition in this scenario is intact, though given his other vital sign abnormalities, he would be a red tag patient. That does it for this simulation episode. For questions and comments, please tweet us at EMS_Nation. You can also find us on Facebook at facebook.com/Pre-Hospital Nation. This is Dr. Faizan Arshad wishing everyone a safe tour.